The novel coronavirus disease, COVID-19, is now a very topical issue. The government of Jamaica is directing its resources to containing the spread of the virus as much as possible. The Ministry of Health and Wellness has sought to trace those who may have been exposed to the virus and have made an appeal for individuals to self-report if they experience associated symptoms. However, at this stage, who knows how many people may have been exposed to the virus directly or indirectly? The coronavirus has an incubation period of 2 to 14 days, which means that the number of people at risk of contracting the virus could be well over 100 by the time the initial person with the virus becomes symptomatic. Welcome back to Elite Jamaica, the place you come to learn about Jamaica and Jamaicans. If it's your first time joining me here, consider subscribing to the channel by clicking that red subscribe button. And do remember to turn on notifications by clicking the bell icon so you never miss any of my updates.
I just love it.
Let's take it from our hearts and spread it wide.
Gotta bring this one out for my brothers and sisters, my neighbors.
We got a long road ahead.
Yeah.
Put together we can do.
As we move about, we have taken various precautionary measures, including frequent hand washing, using alcohol-based sanitizers, and limiting the touching of the face and eyes. Some people have also moved to stock up on food, toiletries, and other items. The government must be recommended for its effort thus far. It is provided as much information as possible using various media platforms to address the concerns of the public. The Ministry of Local Government and Community Development too has ordered that access to the island's infirmaries and Golden Age homes be immediately restricted. This is a welcome move, as indications so far are that the elderly are very susceptible to the coronavirus. However, no plan has been presented in the event that the virus infects the homeless or mentally ill. I present a scenario that could possibly put them at risk of contracting COVID-19. Someone who has contracted the virus could decide to pass food, money, or clothing to a homeless or mentally ill person. The Good Samaritan has not yet presented with symptoms and so does not know he is infected. Hence, unknowingly, passes on droplets to the container or clothing the homeless or mentally ill person, then handles the food or touches his or her face and hereby becomes infected. How will the Ministry of Health and Wellness be able to trace this to the source? What of institutions like the Salvation Army and the Bellevue Hospital? The government is yet to issue directives regarding these types of institutions that treat with vulnerable members of society. Mentally ill and homeless people are at risk as they depend on the goodwill of these institutions and the wider public to survive at times. Also, we dispose of objects such as latex gloves, masks, tissues that may have been infected with the virus. The homeless or mentally ill persons can access them. This could perhaps put them at a greater risk of contracting the virus. The Kingston and St. Andrew Municipal Corporation recently opened a walk-in shower for the homeless. It would be good to hear how access to the facility will be monitored to mitigate the spread of COVID-19. Scientists are unable to say definitively how long the virus remains on clothing or other surfaces. If we follow this line of reasoning, then it means that homeless or mentally ill persons could easily contract and spread it. This video is by no means intended to discredit the activities of the government thus far. What is being requested is a policy adjustment to consider other groups that may have fallen below the radar during the initial planning stages. People who fall within vulnerable communities are less able to access the facilities and amenities that other members of society are able to access or pay for. The situation becomes worse as many of them already have underlying health issues. An emergency plan should be formulated, even if it does not become necessary. People who usually visit and provide care for the homeless and mentally ill need to be properly equipped and protected. Charity organizations that usually interact with these vulnerable groups need to be properly monitored. Transportation costs should be factored into the social spending budget to move the health workers or the homeless or mentally ill persons. Health workers are already having difficulties accessing public transportation, and so their safety and mobility must be secured if they are to effectively treat vulnerable groups. The issue of proper hygiene is a constant issue among the homeless and the mentally ill, but somehow there seems to be a line of thought that the virus will not have the same impact on them as it does on other sectors of society. This as they are already isolated by society, still they are at risk in other ways. The point is, we're a small island nation with comparatively less resources, and we're not privy to any information about COVID-19 that the rest of the world does not have. The government is moving quickly to contain the spread of the virus and has done an excellent job in keeping the nation informed. However, there remains a need for policy adjustments to address the vulnerable groups, specifically the homeless and the mentally ill. Otherwise, we might be thinking we are protecting ourselves, but a whole group of people are being exposed. It is time to pay closer attention to that section of society, which we have long overlooked.
On the road, you kind of feel away on the street that you see all the people them move around with their loved one and them friends, and we just sit down on sidewalk.
Thank you for joining me again, guys. I really do hope you had found this video informative. As I said, it is in no way intended to discredit the government or its activities so far. You can subscribe to Elite Jamaica by clicking that red subscribe button, and remember to turn on notifications by clicking the blue bell icon so that you never miss any of my updates. I am Alex.
I'm on the mission. A mission. Today is the day. Start your ignition. Let's take it away.